Welcome to Behind the Mask. I'm Jason Pozner from Boca Raton, Florida, and I'm here with Dr. Bill Adams and Ellery from Dallas, Texas. Have we got a show for you guys? This show is everything you ever wanted to know about breast implants. Every single day, we're all in clinic and people are asking us questions about breast implants, and then they go on the internet and they get really confused. So our job is to find the real truth about breast implants. So let's talk about first fill, okay? Because we always get this saline versus silicone and the so-called gummy bear implant.
So the most common question that I get on breast implants is, which one is best for me? So the interesting thing is now in the United States, we have more choices of breast implants than anywhere in the world. That didn't used to be the case, but so there's a lot of implant choices out there. But here's the basics that you should know. You can think of it in terms of two main different types of implants. There's saline, which is a fluid-filled implant, and there's silicone, which is a silicone gel-filled implant. The shells of both of those implants are a vulcanized silicone elastomer, which is basically kind of a rubber that has a lot of compliance and can stretch. So that's interesting because they actually have the same shells. Now within both of those two big groups, saline and silicone, there's additional choices for things like surface texture. So you can have smooth implants or textured implants like this one here as a textured surface. So it's like a fuzzy surface implant. In the United States, smooth implants are by far the most popular, and they've always been that way, which is funny because internationally in Europe, they're all texture implants. Jason, you mentioned gummy bear implants. It's the worst term in the world. Actually, I gave a presentation a few years ago about, will the real gummy bear implant please stand up? And at the end, I said we should just abandon the term because it's such a bad term, but it's all over the internet and patients use it all the time. And it just means these more cohesive gel implants, but it's really more just of a marketing term.
I tell the patients that all the silicone implants are gummy bear implants, so I shut that conversation down pretty quickly.
Yeah, and the truth is, even saline or water is cohesive because it doesn't evaporate in the thin air, but there's different degrees of cohesivity, and we can use those to serve certain patients better. So the big thing is that for any given patient, we always are trying to figure out what is the best implant that's going to fit that patient. Not only the type of gel, but maybe the dimensions of it. Again, there's round implants and there's anatomic implants, there's different choices, but we try to customize it basically to give the patient whatever's gonna fit them the best and work the best for what they want.
Regarding the gummy bear thing, I personally like the term because it is an umbrella term, so I think we should normalize the fact that gummy bear is a name for, many silicone implants, I guess you could say. But I think it's an accurate representation of it. Also, gummy bears are, they're trustworthy. Haribo's been around a long time.
They taste good.
They don't fix what isn't broken. So implants are the same way. I mean, they're effective. Everybody loves them. The other thing is, though, the question, which one is best for me? I don't like that question. Because to ask yourself which one is best for me, it is really, you can have kind of a preference, but it is up to your surgeon to decide. I think that we underestimate how much you need to rely on your surgeon to give you that recommendation rather than going into the appointment knowing what you want, because you wouldn't go into any other type of doctor's appointment and say what you need when they need to give you your diagnosis and tell you what you need. So I don't like the question, which one is best for me?
Yeah, and that's so funny, Ellery, because Jason, you've seen this before, I'm sure, all the time too. Same thing with gummy bear, or hey, I want this specific implant, I want this specific size implant. We never saw this 20 years ago.
Yeah.
But now everybody comes in, they're talking, because somebody on the internet or some friend of theirs says, you got to get the gummy bear implant because that's the best one, which is it's like ridiculous. It's like, you want to get the car with the wheels because that's the best one. It's like, it doesn't make sense. But, we never dealt with that. But now, I use the term gummy bear in every consult just because every patient knows it.
Yeah.
And then, my favorite during a consultation is I want 350s because Susie has 350s and they look great on her.
We use this a lot in our office. I am an identical twin, so I guess we'll use it now. I am an identical twin. We're very super identical. same body, even same interests, even our voices sound the same, but our breasts are not the same. We have different implants, different sizes, 3 different sizes, because one of us might have 2 different sizes in each of our breasts. But if identical twins don't have the same breast, patients don't. So when you think somebody has the same build or somebody has the same starting point, just go in with an open mind. Which one is best for you is whatever is told with you, what aligns with your expectations, but what is the best for you.
And I think the other thing, Jason, that comes up is the whole concept of profile. I think profile is almost like the number 2 behind gummy bears, the most misused term in breast implants. So like people hear this, and I think there's this notion that, oh, if you want this look, you want a high profile implant or a low profile implant. So how do you deal with that?
So good question. So we have in our consult room where I do primarily my breast consults, we have the different stickers or different posters from the different companies on the board. I usually walk them over to the Allergan poster and I say, you see all these confusing implants? They go from super low to super high. I'm going to simplify this for you, okay? Unless you're a stripper, you probably don't want super high implants. Unless you're 300 pounds, you probably don't want these super low implants. So most of the time you're going to be with the moderates or the highs or the fulls or the moderates or however you want to call it. And then I show them the differences between a similar size implant, let's say a 350, and the difference is millimeters. So once I show them that on a tape measure, I think it allays a lot of their fears, because when you look at this stuff on the internet, it's very confusing.
Yeah, I do the same thing, but I articulate it in the sense that what's really important is not the profile implant or even the volume of the implant. What's really important is matching the right dimension implant with the right size and volume to that patient's individual breast. And if you do that, we actually have some pictures that we use in the office. You can show patients a picture of somebody who has a 200cc implant, a 300cc implant, a 400cc implant. And if you look at the picture, they all look the same. And it's because their implant fills them to their optimal fill for their given breast. And that's what's important. So if they want that look, which is like a pretty shaped breast, that's what you want. And it doesn't really matter. You know, actually the trivia of high profile, Ellery, is that high profile implants were originally built for breast reconstruction patients, because the thing is they had their breast tissue removed, so they needed more volume in order to fill it up. I mean, the average breast, even if it's somebody that thinks they have small breasts, they probably have 400 cc's of breast tissue already, and then you're adding the implant, which is adding to the breast tissue. So in most patients, just like you're saying, Jason, high profile is not going to fit their breast. If you pick the implant the right dimensions, it's going to be way too high a volume. And if you pick the implant for the right volume, it's going to be like a quarter or something within their breast. So it's not, high profile, even though I think it's got some misnomer along with the gummy bear that some people think it produces like a cool look. It really is not a pretty shaped breast in a lot of patients.
Guys, that was a great discussion. And if you really want more of this, please go to our YouTube channel and follow us, and go to the plasticsurgerychannel.com and see our wide range of videos on a lot of topics. Coming up, we're going to talk about part 2 of breast implants, so stay tuned.